Hey guys, and welcome back to my channel. My name is Keisha, and in today's video I'm going to be talking about all about my C-section experiences, going into it, whether it's scheduled or not, whether it's unplanned, whether or how I coped with it during the hospital, afterwards, a few weeks afterwards. So if you guys are getting ready to have a C-section or had a C-section, or just have some questions about it, definitely leave it down below and I will try to either do another video or answer your question down below. So let's just get into my C-sections. I probably won't try to compare them as much. I did have two, but as you guys all know, pregnancies are different, surgeries are different, even with vaginals. Each vaginal is not the same. You never know what's going to happen. So going into my C-sections, the process of them were the same. Every hospital is different, but I had my kids both at the same hospital. They gave me a spinal, which for me, for some reason, I don't know why, if it was hard for them to find my spine because I'm heavier, I don't know, but that took about 30 to 40 minutes to actually find my spinal, find like a good measurement and all that stuff. You know, you got to hunch your back, and I believe that's the same with an epidural. But long story short, you get the spinal, they lay you down immediately, and then they start like cutting you open. I can say soon after the C-section, you are bedridden. For me, with both pregnancies, it was about the same. I was bedridden for about 6 to 7 hours, and they really want you to use the bathroom, especially after they take that catheter out. So that's like number one. Even with my first C-section, you know, I'm scared with that one, but at least with the second one, like, I have more experience. So after I was bedridden for about I would say 6 to 8 hours, I was like, all right, it's time for me to get up, just because it's really bad if you eat with any surgery just to stay laying down for a long time. If you can get up, they recommend that for you. So I got up, went to the bathroom. It was really hard, but you get it done, and I started moving a little bit. So I would definitely recommend you move as much as possible. And I'm not saying sprint, I'm not saying walk for even 5 minutes. I'm just saying the bare minimum. Sit up as much as possible and walk, like from your door to your bed, maybe twice, as much as possible, just to, you know, not really numb up and get your body used to, like, you know, moving around a little bit, getting your independence back. You don't want to have any blood clots. You want your body to flow, get all that blood out and all that stuff. And that's honestly what I learned with my second C-section, you know, just to keep moving. And like I said, it's nothing crazy. The only, you know, you can't lift and all that stuff. You're extremely sore. So that was the whole hospital experience. I can say this, if this is your second C-section or your multiple C-section, you will be in a lot more pain than your first one, and you may lose a little bit more blood than your first one. Like I said, everyone is different, but with me, it was really hard for me to lift things up. I feel like I was a little bit more bed bound with my second C-section than my first, and that just could be because, like I said, I lost a little bit more blood than my first one. I had a lot more scar tissue. It took a little bit more time, and that's just because it was my second one. Now going home, it's the same thing. You know, they give you medication, narcotics or over-the-counter medication. I would definitely recommend you take those medications as much as needed, not as much as wanted. It's 100% a difference for me. I took my pain medicine for the first I took the pain medication until it was bearable for me. Now, for both pregnancies, it was different. So once I felt like the pain would be tolerable without me taking medicine, you know, you still feel a little bit achy and all that stuff, but you don't want to be so, I need medicine because I feel a little bit ill. So soon as you feel like you can cope on your own, I think it's as soon as possible, stop taking the medication. The medication that they give you, it makes you very sleepy, it makes you very droggy. Sometimes it makes you lose your appetite. It makes you very stuck, and it makes you not even, I feel like it slows down the healing process of postpartum, whether it's baby blues or whether it's, you know, getting, you know, some people may have like 6 weeks of leave, and they have to, like, you know, kind of like rush it to get back into their regular routine. Now, medicine will really like slow that down. That's kind of like the point of medicine, to make you numb, to make you not feel cramps, the pain sensation, all of those things. So I personally think it's best as soon as possible to cut down the medication. Another thing, like I said, continue to walk, continue to drink water. Sometimes they do give you soap, or like a liquid soap, and use that with your incision. Definitely, I don't know, every hospital is different. My hospital didn't give me like any gauze pads or wipes or anything like that. Like I said, they did give me the soap, but they didn't give me the additional stuff. So I would definitely say make sure you have that, just so for the first, I'm gonna say 2 to 4 weeks, you're changing your incision. Now, if you are plus size or a bigger woman like me and you have a fupa, you want to like leave that area as dry as possible, and that's usually why I have like the what is it called, the pads, the gorge pads, I can't even say it right now, but those, I always had those. I never wiped it with anything else, only because they gave me that soap. And actually to this day, today I'm 5 weeks, and it was 4 ounces, and I'm still using it. What else? Of course, like have pads and all that stuff, because you're going to be bleeding. But I think the gorge pads, and the strips are very important to have, so that you can change. It is very, 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 very important to clean your womb. You do not want it to get infected. You do not want it to open back up, like any of that stuff. I have never experienced that. I do not want to experience that. You do not want to have that infection, because you're already sore on the inside. So you don't want to be sore on the outside as well, because that sore feeling, I'm 5 weeks post-op, I believe it went away after about 3.5 weeks. And I think it's because it matters how much you're moving. I can definitely say I was moving a lot the first week and a half. It matters how much help you have. But I like to do everything myself. So I was moving a lot, and I think that's what kind of slowed my process of healing down. So, you know, but everyone doesn't have that, you know, person there helping, or a whole bunch of family helping, or a whole bunch of family nearby helping. So, and some people don't want that help. I'm definitely that person that really doesn't want that help, but it's kind of helpful. So definitely, like I said, take it easy. I was definitely lifting things that I shouldn't have been lifting. And like I said, I think that slowed down the process a lot. But still, to feel normal or somewhat abnormal at 3 weeks, I think is really good. Now that I'm 5 weeks, I feel at 3 weeks, I would say I was about 75 to 80%. And right now I would feel like I'm 90%, because I'm still learning my body a little bit. I think once my cycle comes and all that stuff, I'll feel like a lot better. But you're still internally healing for like a few months. Like I said, the outside wound is pretty good. The incision is good by the time you go to your 5 to 6 week visit. And, you know, you talk to her and she can tell you what you can do, what you can't do. But yeah, even with my first one, you still feel a sensation for, I don't know, up to like 6 weeks sometimes. Like when you're in the shower, I never use a washcloth to wipe that area. I always use my hand. I had like these little cloths that I were reusable cloths that I were using, but I never scrub it. I gently like run my hand through it, just because it's an open wound. It's very sensitive, especially if you had like staples or something like that. I had the dissolvable stitches, but it's a very, very sensitive area. And I'm still to this day 5 weeks scared to like really wipe. I don't remember when I did, maybe 3 months, just because, like I said, it's a very, very sensitive area. So that's it. I don't want this video to be too long. Those are the things that were really, really essential to me with the C-section. It's all about, you know, it's all about your mental. I know having a C-section is hard. Nobody wants a C-section just because of the recovery period. I know a vaginal, I never had one. If you guys had a vaginal, how long did it take for you guys to recover? Some of my friends say up to 2 weeks max. And with a C-section, no, not even. Everybody's different. I would say for a C-section, it matters how you cope with it. For me, it takes about 3.5 to 4 weeks to really feel like, all right, like I feel like me being at 90% right now is amazing. Like it's really, really good. And that's 5-week post-op. And this is my second C-section. So right now, somebody might be like, wow, you just had a kid plus a C-section. So it's all different. Like I said, let me know your experiences down below. I'll catch you guys in my next video. Bye, guys.